My name is Summer, and I will be talking about our research on understanding the sexual and reproductive health needs of immigrant adolescents in Canada, a scoping review. One of the most diverse countries in the world that continually welcomes immigrants with open arms, Canada. However, there are few resources available for an important health field for immigrant adolescents, their sexual and reproductive health. The cultural value systems of immigrant families differ from the West, which is a barrier in accessing SRHR, sexual and reproductive health and rights, resources. To explore how and why that happens, we executed a four-phase project. First, we formed an adolescent advisory group, followed by a scoping review of literature on SRHR needs and its impact on physical, mental, and social well-being of immigrant adolescents in Canada. Then, focus groups were scheduled with parents and adolescents to identify culturally specific sexual health service and education gaps. Finally, we conducted an engagement evaluation with the adolescents. I am presenting the findings of the scoping review, which was undertaken following the PRISMA scoping review. The PRISMA scoping review, or the Preferred Reporting Items of Systematic Reviews and Meta-Analysis Extension for Scoping Reviews, is a rigorous approach to help us determine whether a systematic review of the literature is certified. We use this approach to identify and assess the existing literature regarding SRHR needs of immigrant adolescents in Canada. Of the 1,014 articles retrieved from our search strategy, 15 studies met our inclusion criteria. Our review identifies three main themes related to immigrant adolescents' SRHR needs: knowledge needs, access to SRHR education and services, and approaches to SRHR education and services. There are many immigrant adolescents' knowledge needs, which includes HIV or STI transmission and protection, unintended pregnancy, sexual activity, family planning, pubertal education, navigating the healthcare system, and confidentiality legislation. When it comes to accessing SRHR education and services, immigrant adolescents go through either their school sexual education classes or through family, friends, or doctors. Lastly, immigrant adolescents value these qualities when wanting to learn about SRHR education and services: cultural sensitivity, an intersectional approach, interactive learning, a strength-based approach, and firm confidentiality rights. Knowing these multifaceted SRHR needs of immigrant adolescents in Canada can contribute to future research and policies that reflect on these three themes. Again, knowledge needs, access, and approaches to SRHR education and services, so that there is an aim to meet or lessen these needs. By doing so, inclusive SRHR education and services can be attained through a cultural and intersectional strategy, because it is not diversity, but rather inclusivity that promotes the excellence of a nation. Thank you.